The question comes up nowadays that what if I don't have enough bone, or can I get implants put in? And for the most part, there's very few circumstances that we cannot regrow bone, or we can't find a way to have an implant put in to help us. There's so many different ways that the science has helped us in the regeneration of bone. The latest is actually being able to use what's called BMP, bone morphogenic proteins, that are synthesized, that we can put on a piece of collagen, put it into the mouth, under the gum, and it recruits your own stem cells to create bone. So you can literally grow bone right wherever you put it. You can use a little mesh and put that inside, and the bone will grow within this mesh. The body roughly regenerates bone 1 millimeter a month. So if we need 3 to 4 millimeters of bone, then we're looking at 3-4 months. If we need 6 millimeters of bone, it's going to take 6 months. So a lot of it is involved with how much we need. I think a big change in dentistry is nowadays when we extract a tooth, we think right away about putting bone into that socket. We don't like the body to just go ahead and take its own, path. So today when you extract a tooth, you put in bone and you preserve the size of that ridge. So later when you need to put an implant in, you have something there. But a lot of people have had teeth out a long time ago. So if you were going to go in and rebuild some of the bone, probably at the most you're between 4 and 6 months as a general rule. Then put a few implants in. At that point it may be a couple more months. So many times you're looking at 6, 7, 8 months of healing before they would have a denture or a partial or a crown put on the implant, if you have to regrow the bone. Now, if someone comes in and they have bone and the tooth was extracted years ago, we can put an implant in, and 4 weeks, 6 weeks later, you can put a crown on there. So it can be as simple as having a crown within 6 to 8 weeks from when we put the implant in. Now, there's a lot of advertising now about all-in-one. Come in today and tomorrow you'll have everything done. There are ways of putting things together for patients. There are some patients that just can't go without teeth, and there are ways of putting that together. It's a fairly expensive process, but it can be done. But it's a little misleading that everybody that comes in, we can get an implant in and a crown, by the end of the weekend. It takes time for nature to heal, and the more we push the envelope, the more we run into problems. So you want to be able to weigh this. Is it that important to speed through something and then possibly have a problem that now it's going to take you twice as much time, because you have to remove whatever you've done, you have to let that heal, now you got to build it up again, and then come back with whatever you feel was a better way to go. Every one of us have tried to help the patient for one reason or another, and then we've paid the price. Now, a lot of times it works out just fine, and we love it. But boy, when it doesn't, you live with that for a long time.